Okay, I'm kind of excited because this is the first opportunity that I get to meet Dr. Ferguson.
It's a pleasure to have you here.
No, it's a pleasure, sir, and you've done so much great things, and you are the world expertise in so many things, but you have access to some unbelievable equipment as well.
We've got some cool stuff. We've got some really cool stuff.
What are you going to be showing us today, especially in regards to laser and laser light therapy?
Well, today we're going to talk about the laser treatments that we use more for skin, for lesions that develop externally. We've talked before about the laser that I use for fat.
Yes.
This is more of a traditional type of laser that we use to cut and to rejuvenate the skin, as well as removing certain types of pigmented lesions or vessels that come up.
Tattoos and those things like that?
Tattoos.
I understand.
Basically, anything with a pigment we can treat with non-ablative therapy, but we also have one of the best ablative lasers that is around. And what this allows us to do is really be very, very precise in certain aspects of how the laser interacts with the skin. The problem is how long it takes for things to heal. When you do that, the gold standard for skin care or skin rejuvenation is laser resurfacing, where you take off layer after layer after layer of skin till you get to the very bottom to get the best results. We can do it with chemicals, we can do it with dermabrasion, but by far the most precise is with a laser.
Right.
The problem is that's a big burn. That's basic. What you're doing is a big burn, and it takes a long time to heal. You can't be outside until you can wear sunscreen. Now we have found something called fractional therapy, which allows us to get that heat all the way down to the bottom, making tiny little precise holes in the skin.
And it's amazing, you're showing right here, and I literally had to look tiny, tiny, tiny.
Yeah,
but
tiny little holes.
What is the benefit of just doing those holes that get down there, but just...
The heat, you're ablating some of the tissue, so you're removing the tissue, so it's going to grow back. The other thing is you can, if you get that heat down there to the bottom layer, it's actually going to cause new collagen to form. Now we're going to get into some of the other types of lasers that are non-ablative, that actually can do some things because of the properties that they have as far as what kind of light they emit. The CO2 laser is a very specific wavelength.
Powerful.
Exactly, it's very powerful. The other lasers are very specific. They have different lights that are specific for other things, like I mentioned before, melanin, hemoglobin, some do water, but not as much. Or you can just use something to heat the skin itself. That will cause deep dermal heating, and we have an entire room with all kinds of different lasers. If you want to take a peek.
Yeah, can we go check that out?
Sure.
Awesome. Okay, Dr. Ferguson, we're kind of in the back now, and first of all, who do we have
This is Jenny Chu, our esthetician, who pretty much runs our non-ablative techniques, our modalities that we have available. She's been doing it. She's great, and just knows his equipment backwards, forwards, sideways. So whether it's hair removal, whether it's tattoo removal, skin tightening, you got a couple of freckles you want to get rid of, or you got a vein that's popping up somewhere, or just a vessel. These can go after those specific lesions. The other laser we talked about basically burns everything because it's going after water.
I understand.
These here go after different, what we call chromophores that are in the tissue. And you know, each laser has a unique wavelength. Well, there's also, we have lasers that do that. And we also have something called IPL, which is intense pulse light, which has a band of frequencies. And if it's intense enough, it'll give you the same benefits as the laser. There's not as much downtime, however, it takes more treatments.
Interesting.
Usually we'll take multiple treatments, and that's really where the trade-off comes from.
Forgive me for asking, but literally can someone just come in during their lunch break and literally get something and then walk? I mean,
absolutely.
Oh, wow.
With these kind of treatments that Jeannie does, absolutely. Absolutely.
And you see success, it just takes a little time in the therapy, you guys decide.
Well, there's certain things. Facial rejuvenation, hair removal, those will always going to take multiple sessions. If it's just a vessel here or there, or a couple of pigmented lesions, you can get rid of those in one treatment usually.
May I ask, is it nice being able to serve your clients because you have both options and you can kind of work at a plan?
Absolutely, because you really have to take the patient's lifestyle into consideration. To me, I'm a surgeon, and so, you know, I can sometimes take the more aggressive route with the laser, which is pretty much considered surgery, because we're removing or incising tissue. But that does have some downtime with it. But you can get some absolutely phenomenal results using non-ablative techniques.
Well, that's what I love about you, too, is because your experience, you can kind of guide people through that and explain that, because you've done pretty much everything. You've done it all.
I've been doing this since the day I got out of residency. I bought my first laser Within about 6 months of getting out of residency, I've probably gone through about 20 of them in the last 10 years. And I always like to try just the newest thing.
Well, like you said, you're always keeping up on the techniques.
Absolutely.
What's over benefits.
Absolutely.
Dr. Ferguson, thank you so much.
Thank you for having us.
It's amazing to know and have all this different equipment here, but again, knowing that everybody out there has all the different options that they can use. Thank you so much, sir.
Thank you very much for coming.